Next, we're going to be looking at bone repair. So fractures or breaks, they usually happen during youth because of trauma and old age from weakness and due to bone thinning. When we're looking at fractures, there's actually 3 either or fracture classifications. For example, we can look at the position of the bone ends after fracture. When bone ends are non-displaced, that means the ends retain the normal position. When bone ends are displaced, that means the ends are out of normal alignment. There's also completeness of the break. When they're complete, it's broken all the way through. Incomplete, not broken all the way through. We can also look at whether the skin is penetrated. So if it is, it's an open or compound break. So the skin is penetrated when it is a compound fracture or an open fracture. A closed or simple break is when the skin is not penetrated. So a simple fracture or a closed fracture is when the skin is not penetrated. But we can also describe fractures based on their location, their external appearance, and the nature of the break. So let's look at some examples. All right, here on the left, we have a comminuted fracture. This is when bone fragments are in at least 3 or more pieces, more common in the aged whose bones are more brittle. Then on the right, we have a compression fracture where the bone is crushed, and that's common in porous bones or osteoporotic bones of the elderly. It could also be common in someone who's subjected to extreme trauma or, for example, has fallen. Then we have the ragged break that occurs from excessive twisting forces, especially when they're applied to bone. That's a spiral break, and it does have a spiral appearance along the diaphysis of the bone. This is a common sports fracture. Then there's epiphyseal breaks, where the break happens along the epiphyseal line, essentially where the epiphyses separates from the diaphysis. So at that epiphyseal plate. It tends to occur really when cartilage cells are dying, calcification of the matrix is occurring, and so you might have some abnormal bone development if that's occurring. Then there's depressed fractures. Broken bone portion is pressed inward. That's a typical skull fracture. And then green stick are more common in children because their bones have relatively more osteoid or that organic matrix, and therefore they're more flexible than those of adults. So a green stick fracture is really when bones break incompletely and kind of the way a green twig breaks. And so only one side of the shaft breaks and the other side bends. So how do we treat fractures? Well, we treat fractures by reduction or the realignment of a broken bone, especially its ends. A closed reduction is when a physician manipulates the bones to the correct position, whereas an open reduction usually requires surgical pins or wires to secure the ends of the bone, and then we follow that up with immobilization with a cast or some type of traction mechanism needed for healing. And then it just takes time for repair, and it does depend on the break severity on how long the bone takes to repair. It also depends on how many bones were broken and the age of the patient. So next, let's look at fracture treatment and repair. After we've kind of gotten everything back in order, bones are aligned to the best of our ability, we will see the repair that involves 4 major stages. Hematoma formation, fibrocartilaginous callus formation, bony callus formation, and bone remodeling. Hematoma is a blood tumor. So this occurs once blood vessels are torn, initially after trauma, and you see a massive clotted blood form. The site is generally swollen and painful and inflamed. So we can see in this image, step 1, or the hematoma formation. We can see that blood kind of pulling in an area near the break and kind of pulling up under the periosteum. Next, when growth starts to occur, you have capillaries grow into the hematoma, you have white blood cells that are phagocytic, that clear debris. Fibroblasts start to be created, and this is kind of a general connective tissue building cell that secretes collagen fibers to really kind of help span that break and reconnect the broken ends. Fibroblasts, cartilage, osteogenic cells, all of these are present to begin reconstruction of bone. We do create, though, first a cartilage matrix of repair tissue called a fibrocartilaginous callus, and then later osteoblasts will form spongy bone within the matrix. The initial soft callus is the fibrocartilaginous callus. So again, that's created by those fibroblasts that arrive. Blood vessels also start to repair themselves, And within 1 week, we generally then start to see a bony callus form. So we see new trabeculae appear in that soft callus, and the callus is converted from a soft callus to a bony hard callus of kind of new spongy bone. And the bony callus formation continues for about 2 months until it's really formed and it's firm and a union is formed between the two bone ends. So here in this image, we can see the bony callus formation. We can see the new blood vessels that have healed, and we've moved from a soft callus to a bony callus. And then last but not least, we have bone remodeling, and that begins during bony callus formation and continues for several months. So any excess material on the inside or outside of bone would be removed, and compact bone would be laid down on the outside to reconstruct the diaphysis walls if needed. And this would continue until the final structure resembles the original structure. And then it would continue to respond to the same mechanical stressors and hormones of all bones. So let's review. We have hematoma, fibrocartilaginous callus, bony callus, and then last but not least, what we see here, bone remodeling, until everything looks just like it did before the fracture. So this is a healed fracture. You do need to know the stages in healing of bone. So after bone breaks, a hematoma forms, replaced first by a soft callus called a fibrocartilaginous callus, then a bony callus made up mostly of spongy bone, and then bone remodeling begins when the bony callus forms and continues lifelong, even after bone remodeling has completely made the fracture look like it did before. All right, next we're going to finish up by looking at bone disorders, so make sure to come back for that video.